Somatization disorder, also known today as somatic symptom disorder, is a psychiatric condition where a person experiences multiple, persistent physical symptoms, such as pain, weakness, or digestive problems, that cannot be explained fully by medical illness. These symptoms are real and distressing, but they are closely related to psychological and emotional factors. The condition often interferes with daily functioning at home, work, or school. The exact cause is not fully understood, but several factors play a role. Psychological factors, such as unresolved trauma, chronic stress, anxiety, or depression, are significant contributors. Genetic influences also play a part, as having close family members with mental health conditions can increase an individual's risk. Furthermore, childhood experiences, particularly growing up in an environment where physical complaints were rewarded with attention or where emotional needs were consistently ignored, can contribute. Certain personality traits, such as a low tolerance for stress or difficulty expressing emotions, can also lead the body to speak through physical symptoms. Finally, cultural factors also matter. As in some cultures, people may be more comfortable expressing emotional distress as physical illness rather than openly discussing their feelings. People with somatization disorder commonly report chronic pain, including headaches, back pain, or joint pain. Gastrointestinal problems are also frequent, manifesting as stomach pain, nausea, bloating, or diarrhea. Neurological-like symptoms, such as dizziness, weakness, or even fainting, can also occur. Persistent fatigue and constant low energy are often present. There is often excessive worry that these symptoms signify something very serious, even after receiving medical reassurance. This leads to frequent doctor visits and repeated medical tests, which typically yield normal results. A key feature is that symptoms often worsen when the person is stressed, anxious, or facing emotional conflict. Somatization disorder can take different forms. First, there is somatic symptom disorder, characterized by multiple physical symptoms accompanied by ongoing worry and preoccupation. Second, illness anxiety disorder, sometimes referred to as hypochondriasis, involves a persistent fear of having a serious disease, even when physical symptoms are mild or absent. Third, conversion disorder, also known as functional neurological disorder, presents with symptoms like paralysis, blindness, or seizures, all without a clear medical explanation. Fourth, pain disorder is characterized by pain as the primary symptom, which is strongly influenced by psychological factors. Finally, undifferentiated somatoform disorder applies when one or more physical symptoms are present, but do not fully fit the criteria for the other specific categories. Diagnosis requires careful evaluation. First, doctors rule out physical illness through medical history, physical exam, and basic investigations. Then, mental health professionals use DSM-5 criteria. These criteria include at least one distressing physical symptom lasting for 6 months or more. Additionally, there must be excessive thoughts, feelings, or behaviors related to these symptoms, such as constant worry, repeated checking, or actively avoiding activities. And finally, the symptoms must cause a significant impact on daily life and overall functioning. It's important to note that these symptoms are real, not imagined, but their explanation is more psychological than physical. Treatment focuses on improving quality of life and reducing distress, not on eliminating every symptom. Psychological therapies are considered the first line of treatment. Cognitive behavioral therapy, or CBT, is particularly helpful as it assists patients in understanding the connection between their mind and body, reducing health anxieties, and building healthy coping strategies. Other effective approaches include stress management, relaxation training, and supportive psychotherapy. Medications may also be used, especially if there are associated conditions such as depression or anxiety. Selective serotonin reuptake inhibitors, or SSRIs, and serotonin norepinephrine reuptake inhibitors, or SNRIs, are among the most common choices for this purpose.